virtual support group for parents living with brain injuries. And I'm also very proud to be serving on the Survivors Council for the Brain Injury Association of America. And this morning I'm here to talk with you a little bit about my story and my journey with brain injury and why I feel that early detection is so important when it comes to brain injury. I sustained my brain injury in May of 2017. I was struck by a car that was traveling 48 miles per hour while crossing the street in downtown Phoenix. I had actually only been there for about 6 months, so it was like, welcome to Phoenix, now you're hit by a car. I was thrown 15 feet up and 100 feet forward from where I was struck and sustained multiple injuries. When I was transported to the hospital, I actually was not diagnosed with a concussion or brain injury while I was there. I was at the hospital less than 24 hours. Which I later found through my advocacy work and meeting other survivors, that was actually not a very uncommon experience, at least not where I lived there in Arizona. And really I was made to feel as if I was making a bigger deal out of the things that I was experiencing than what they actually were. I was letting them know that I was feeling the dizziness, I was having issues with my vision. Every time I moved my head, it felt like the whole room was spinning, but essentially all of that was kind of ignored while I was there at the hospital. I was told by, well, not by the doctor, I was told by the nurse from the doctor that if I could make it from my bed to the bathroom that was there in my room, then I was good to go home. And I had a broken fibula, and so therefore I had a walker, and I'm absolutely positive that that's the only reason that I was able to make it from my bed to the bathroom at that time. And so I was discharged and really not given any instruction about what to do in terms of all these symptoms that I was experiencing as a result of my injuries. There was a lot of things that I actually didn't catch while I was there. They were making primarily a big deal about my broken fibula, which in hindsight was really probably the most minor thing that I experienced, especially having these long-term issues from the brain injury. They also didn't catch that the bones and ligaments in my jaw were dislocated, although looking back at the pictures, it was very obvious that it was not attached the way that it was supposed to be. And I'm not here to trash on emergency physicians at all. I'm very grateful for what you do, and I'm very grateful that you're here to hear my journey the advocacy work. And so I also, during the course of between the time of being hit and when I was transported to the hospital, lost consciousness several times. They asked me about that when I was at the hospital, and I told them, I was awake the whole time because that's what I remembered, but it turns out that that was not true. That information was not related to me. They told that to my family as we were being discharged. And it was something that we spoke with my neurologist about. He asked me, how long was I out of consciousness, because of course, as you know, that can have an effect on, or an indicator about how the long-term effects are going to be. And I said, I have no idea. I was not told any of this information at the hospital. It was not in my records. So again, that early detection would have been really helpful to be able to go forward in getting better treatment, better assessment as I went forward in my brain injury journey. I did eventually receive a referral to a sports medicine and concussion center where I did finally get diagnosed with a concussion and traumatic brain injury. This was about, let's say, a month after the initial injuries occurred. And I was referred to a neurologist, and he's been amazing in helping me to make sure that I am able to get the long-term care that I need, as I do still continue to have effects from the brain injury. Some of the things that I still experience now as a result of the concussion and brain injury, I have nerve damage, vestibular issues, I have problems with my balance. In fact, actually just a little bit ago, I did tumble out there on the way in here. All the sensory and all those things really started to affect the way that I was able to walk and move and all those things. So I still continue to have vestibular issues now, even 7 years later. I also still have vision problems, primarily with vergence. And all these things were really occurring at the hospital at the time as well. When I would attempt to look at something with my right eye would just pop out like it was done, it was not happening. And so I am also in vision therapy for that and long-term care for vision issues. And again, I told them all this in the hospital, but again, I was not really believed with the severity of the things that I was experiencing. And so I could not do anything independently after sustaining these injuries. I couldn't drive, I couldn't cook for myself. I had to be carried back and forth to be able to use the restroom in my home. I was really grateful that my family was able to step in and help me with all of those things because I was not able to do anything independently at that time. And especially being a single mother, that had even more of an impact on me. I had a young son. The accident happened just shy of his 11th birthday, and so he also stepped in to be a caregiver at that time to help me with all the things that I was not able to do independently. And I do really feel that had I been able to have that early detection, that early assessment, I would have fared much better. I would have been able to get into those therapies that I needed. I would have been able to get all the assistance that would have been much more helpful for me to be able to go forward, being healthier and not having such severe long-term effects with the traumatic brain injury and concussion. And I certainly wouldn't have suffered as much or for as long in that time in between when I sustained the injury, when I was finally able to get the therapies and the things that I needed. And it was also something that had an impact on my family. I think that's an important thing to also keep in mind, that it didn't just happen to me, it happened to my entire family. So had I had that early detection and gotten those services earlier, then they wouldn't have been affected as much as well, having to come in and do so many things for me so early and for so long. And I also experienced a fair amount of gaslighting throughout the process from medical professionals in the early time after the accident. And again, I feel that if I had had that early detection to kind of legitimize the things that I was saying, that would have been really helpful to say, I've had these tests done, I've had these things, and so they wouldn't just be taking my word for it, even though that should have been enough. And so I really am grateful that you all are here to hear my story and hear the survivor side of what goes on when concussions and brain injuries occur. I appreciate that you're coming from the scientific side, you're coming from the knowledge-based side, but there's also the lived experiences, which is very important to hear, so I really do appreciate you being here to hear those. And I still have long-term issues from my concussion and brain injury. I get frequent migraines, I have balance issues, vision issues, I have problems with cognition and memory, especially short-term memory. That was one that primarily was affected. My family likes to joke with me that they'll tell me something and then I won't remember it immediately, but then they'll be like, well, okay, ask her about a week and then it'll come back to her. I also experience sensory sensitivity as well as fatigue. And again, from the survivor perspective, two helpful things that kind of come from the process of not just my experience, but also working with other brain injury survivors. I like to call it, jokingly, leading the witness, because I kind of feel like that's what medical providers sort of see it as, that it's okay to ask the patient, not leading questions, but ask them, because we don't have that technical knowledge. We know what we're experiencing, but we may not remember it, especially having sustained brain injury, or we may not know what's relevant or what we should be telling you. So it's okay to ask us specific questions. That was really helpful for me during my time, because I did not have experience with brain injury prior to sustaining mine. And so I didn't know what was relevant. I didn't always remember all of the things that I was experiencing, but once those questions were asked, I was like, oh yes, that is something that I am experiencing. And then also, I think the lifestyle questions are really important too, to take those clues from survivors. What kind of things were you able to do before? What kind of things do you have difficulty doing now? For me, it was things like reading or cutting vegetables. Those things were clues as to what was going on with me with my vestibular issues. And so those were the things that were really helpful in my time and in my journey as a survivor, getting that help and assistance that I needed. And I do also feel that regarding those two things, those also would have been far more effective if I had had that early diagnosis, because I feel that the providers would have been able to know what kind of questions to ask me, having known what I was experiencing and having again legitimized what the injuries that I had sustained. And just a side note, it was kind of interesting during my time in the emergency room, because a lot of the things that I was telling them, again, were not accurate as to what had occurred based on what the witnesses had told me and all of that. And I was laying there in between the time after I had been struck and waiting for someone to help me. The driver actually never got out of his car to assist me, so a good Samaritan happened to see what happened and he came over. And I was laying there, and I don't know if any of you have seen the Bruce Willis movie, I think it's called Glass, where he ends up being a superhero. And so I was, sorry if that's a spoiler alert, but the movie's like 12 years old, so if you haven't seen it. So he's laying there after this accident, and somehow he's miraculously survived. And so I was laying there totally delirious, and I was like, oh, well maybe I'm a superhero. And I'm no superhero, but I am here to advocate, and I again appreciate you being here to hear my story and why early diagnosis is important. And I would just like to leave you with the question, something that gets asked me all the time because I do appear to be an able-bodied individual, is that people will say to me, oh, but you don't look disabled. And so I always have to kind of catch myself because I want to say, well, what does a disabled person look like? Can you describe that to me? Because this is what a disabled person looks like. This is what a concussion and traumatic brain injury survivor looks like. And so I really, again, appreciate you listening to my story and for all of the work that you do for your patients and those who